Medications for some types of heart failure do this. The research has shown that on good doses of some of these medications, patients tend to feel better. They stay out of the hospital longer. Some of them will even live longer. And some of these medications actually go in and help interrupt some of the stress hormones and chemicals in your body that can promote further damage to your heart. So a lot of these medications that we will use in heart failure are actually protective of the heart and help to fight off any future damage that can happen to your heart, as well as helping it to work as best as possible and to help you guys feel better for as long as possible. Of course, a key with all these medications is taking them as prescribed. If you have any questions about why you're specifically on a medication or why it needs to be taken a certain way, ask us. We have so many patients that may be scared of a medication or have a side effect from a medication and they just stop the medication altogether, and we find out 6 months later. So if something is going on, we genuinely want to know. So if you have any concerns about anything, you can pick up the phone, you can call Sherry, you can call me, you can call the advice line. But we, on our team here, we legitimately want to know what's going on, and we want to know before your next appointment. So don't be afraid to ask. So some common medications that we're going to go through today. Again, everyone's regimen is going to be specific to them personally, but common medications used in heart failure, we're going to talk about ACE inhibitors and angiotensin receptor blockers. We're going to talk about beta blockers, diuretics or water pills, aldosterone antagonists, and then another type of medications called hydralazine and nitrates. So we're going to go ahead and start out with a very common medication in heart failure, and these are called ACE inhibitors. These are the ILs. Here, the most common one we use is lisinopril. And this is one of those medications I was talking about that is very protective of the heart. It's also protective of the kidneys. Another thing it does is it does dilate your blood vessels. What this does is it allows easier flow of your blood to all of your vessels, to all of your organs that need that blood. And it's, like I said, one of those medications that can help you feel better, hopefully keep you out of the hospital, living longer. There are some side effects that you want to watch for. It can lower blood pressure. So a lot of times we'll follow up with you to see how your blood pressure is doing on these medications. We do like to keep an eye on the kidneys and potassium to make sure that they're doing okay on this medication. One of the most problematic side effects that patients will get is sometimes they can get a dry cough on this medication. If that's the case, usually we'll switch you to the next medication we're going to talk about, which is an angiotensin receptor blocker. The most concerning side effect, though, with this medications is some patients can get some swelling of the face, the tongue, the cheeks, the mouth, the throat. If this were to happen, this is a medical emergency. Go ahead and go to the ER. It's very rare, but it's something that I do like to mention to the patient so that if it were to unfortunately happen, you would know what's happening. So our next class of medications, the angiotensin receptor blockers. This is the medicine that we switch you to if you have a cough or a bad effect on the ACE inhibitors. These are all our TANs. The one that we use here most commonly is losartan, and for some patients we have them on valsartan here as well. These medications are very, 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 very similar to the ACE inhibitors. They have the same functions. They're protective of the heart, they're protective of the kidneys, they help dilate those blood vessels to get the blood flowing to the organs, and the side effects, again, are very similar with the exception that these do not cause cough. So again, it kind of goes back to communication. If your physician prescribes you an ACE inhibitor, lisinopril, and you have a cough, let us know because we have an alternative. We can switch you to something else that is a very good medication that will get rid of that nasty cough. So next medication we're going to talk about are beta blockers. Carvedilol, metoprolol, and bisoprolol are the ones that are used for heart failure, and we do use all three of those here. These are, going back, another medication that is protective of the heart. Instead of dilating and opening up your blood vessels, though, it actually helps to slow your heart rate down. This allows your heart to fill with blood better when it's beating at a slower rate. So it's going to be more efficient. It's going to fill up with more blood, so it's able to pump out more blood. It also is one of those medications that can help you feel better, help you, hopefully stay out of the hospital, interrupts those stress hormones that can cause damage to the heart. Now, since it does slow down the heart rate, we want to keep an eye on your heart rate. We want your heart rate to be in a certain range, but if it drops too low, patients can sometimes feel things like dizziness, lightheadedness. If you're experiencing any of those things, let us know, because we may need to check your heart rate to make sure that it's still in the good range and hasn't gone too low. Other than that, very few side effects generally with this medication. If you do have diabetes, you need to be aware that these medicines can sometimes hide those hypoglycemic effects, with the exception of sweating. So just something to be cognizant. If you're diabetic, you're on insulin, you need to be even more diligent in checking your sugars, because this can sometimes hide those low sugar effects. For some patients, it can cause a little bit of weakness, fatigue. A lot of times that'll be transient. Usually when we first start it, you may have a little bit more fatigue, but that will improve after a couple weeks of being on the medication. And some men will have some sexual side effects with these medications. Again, if you experience any of these things, let us know. We can always work with you and try to get you on something that works for you. Okay, so aldosterone antagonist. This is the last medication that I'm going to talk about that falls under that umbrella of protecting the heart. This medication here, we commonly use spironolactone, although there is an alternative medication for it. It's called eplerenone that we will sometimes use for patients. This medication does a lot for you. Like I said, it helps prevent the heart, reduce all those stress hormones. In addition, it also serves as a mild fluid pill. So it'll help get rid of some of the fluid. It also helps your body hold on to potassium, which our body can lose from other water pills. So this acts as a very mild water pill, but also helps your body hold on to potassium. There's some benefit of this medication for patients with sleep apnea. So you get a lot of bang for your buck with this medication. Generally, it's very, very well tolerated. For most people, it doesn't affect their blood pressure, their heart rate, any of those things. We will do some routine lab monitoring because we want to keep an eye on the potassium that we're helping your body hold on to, and the kidneys. The most common side effect that is generally seen here, it's not common, but it can be troublesome to people, is a little bit of breast tenderness. And again, if you are on this medication, you experience this, let us know. There are alternatives. We can always try you on eplerenone, which has a lower incidence of having any of that side effect. This, like I said, is one of those last medications that is very protective of the heart. We don't have all of our patients on this medication, though. This one is very specific for certain patients that we've seen benefit with. So, diuretics or water pills. These medications, I saw that. These medications do not fall under the classification of medications that are protective of the heart. Now we're talking about helping you feel good and keeping the fluid off. With heart failure, most of our patients have problems with retaining extra fluid because of the heart failure. Think of it as Atlanta traffic with short stoplights. Your heart is pumping less blood with each beat. So that's kind of the equivalent of a backed up stoplight with a short light cycle. Fewer cars are getting through with each light cycle, so you have the buildup. Well, the fluid's sitting in your lungs and your ankles. Your lungs are like, hey, I'll absorb you. You can hang out here for a while. Same thing with the ankles. And that's where you get a lot of shortness of breath, a lot of swelling, and it's difficult for that fluid to get back into circulation. And that's where these come in play. Furosemide and torsemide are the two that we use most commonly here, and they do a very good job of sucking that water back up into your veins and excreting out through your urine. So it's not without side effects. These can lower your blood pressure because we're losing a lot of fluid out. We have to watch your electrolytes very carefully because where water goes, sodium and potassium are going to follow. So a lot of times we'll have patients on potassium replacement if we have to use these as well. We like to watch the kidneys because these medications can be stressful on the kidneys, which is why we talk so much about everything Sherry talked about, weighing yourself at home, letting us know early on if you're gaining weight, because then it's a lot more gentle to get 3-5 pounds of fluid out If we have 20, 30, 40, 50 pounds, that's a lot more stressful on the kidneys. So that's why we stress so much, letting us know early on. And metolazone is another diuretic. Sometimes we will use in combination with the other medications if we need that extra bang for our buck. So some other medications I just want to touch on briefly, because these are very common medications to see in heart failure, but they're very specific to the patient, depending on what other heart conditions they have, how their blood pressure is running, and what their symptoms are. So some medications that we will use pretty commonly is a blood pressure medication called hydralazine, and something called nitrates, which could be nitroglycerin, or most commonly isosorbide, either mononitrate or dinitrate. Commonly we'll use those in patients that can't take some of the other medications that we would normally use as a replacement, or in patients that maybe still have some higher blood pressures on those medications. These are beneficial. Digoxin is another medication that some patients may be on. Blood thinners, depending on what other heart conditions you have, you may be on aspirin or Plavix or warfarin. Antiarrhythmics, if you're having an irregular heart rate, sometimes we'll put patients on these medications to keep their heart in rhythm, to help their heart be able to pump better and perfuse. Amiodarone is the most common one we use here. And then cholesterol medications. Simvastatin, atorvastatin are the most common ones we use here, but we also have lovastatin, pravastatin, and rosuvastatin or Crestor. Typically, we use these in patients that have other heart disease, if they've had a history of coronary artery disease or strokes or diabetes. And while these medications aren't treating heart failure specifically, they're very important, because what they're doing is they're helping to protect your heart